Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Infant and newborn development. Introduction. A child's growth is more than just physical. Mastering new skills such as how to crawl, walk, and talk are developmental milestones. During their first year, babies start to develop skills they will use for the rest of their lives. Not all babies develop at the same rate. There is a wide range of what is considered normal. This program will help you understand infant and newborn development. It discusses the different areas of development, as well as when to seek medical advice. Infant and newborn development. Children grow, develop, and learn throughout their lives, starting at birth. How your baby plays, learns, speaks, and acts offers important clues about your infant's development. You can help your child's development by providing a safe and loving home. Playing, singing, reading, and even just talking with your child can make a big difference in his or her development. It is also important to provide your child with proper nutrition, exercise, and rest. Developmental milestones are things most children can do by a certain age. A developmental delay is when your child doesn't reach the milestones at the same time as other children the same age. Your child may be ahead in some areas of development and slightly behind in others. If you are worried about possible delays, talk to your child's healthcare provider. Knowing when your child should meet certain milestones can help you determine whether there could be a problem. The following sections discuss the different areas of infant and newborn development. Movement and physical development. Movement and physical development is just one area in which a baby develops. By the time he or she is 2 months old, your baby should be able to hold his or her head up. At 2 months of age, most children are able to make smoother movements with their arms and legs. Your baby should also begin pushing up when lying on his or her tummy at this age. By the time children are 4 months old, they should be able to hold their head steady without support. At this age, babies may also push down on their legs when their feet are on a hard surface. Many 4-month-old children are also able to push up to their elbows when lying on their stomach. Some babies this age are even able to roll over from their tummy to their back. 4-month-old children may also be able to bring hands to mouth, hold a toy and shake it, swing at dangling toys. Your baby should be able to roll over in both directions by 6 months of age. Your baby may even begin to sit without support by this age. At 6 months, your baby's legs should be able to support his or her weight while standing. Your baby may also begin to bounce at this age and rock back and forth. He or she may even crawl backward before moving forward. By the time your child is 9 months old, he or she should be able to crawl. Your child should also be able to get into a sitting position and sit without support. Most 9-month-old children are also able to pull themselves up into a standing position. Some may even be able to stand while holding on to something. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Cognitive development. Cognitive development includes learning, thinking, and problem solving. Around the time a child is 2 months old, he or she should begin to pay attention to faces. By 2 months of age, babies should be able to recognize people from a distance. It is also common for children of this age to begin following objects with their eyes. Children at this age also start to act bored if the activity around them doesn't change. Babies may show they are bored by crying or becoming fussy. By the time your baby is 4 months old, he or she will respond to affection. Your baby will also let you know at this age if he or she is happy or sad. By 4 months of age, most babies also follow moving things by moving their eyes side to side. Use hands and eyes together to see a toy and reach for it. Reach for a toy with one hand. Recognize familiar people and things at a distance. 6-month-old children often show curiosity about things. At this age, your child may try to get things that are out of reach. He or she may also look around at things nearby and bring things to his or her mouth. Your 6-month-old may also show curiosity in how he or she interacts with objects such as toys. Your child should begin passing things from one hand to the other at this age. By the time your child is 9 months old, he or she should be able to play peekaboo. Your child should also look for things he or she sees you hide. 9-month-old children are also able to move things smoothly from one hand to the other. Pick up things like cereal between thumb and index finger. Put things in his or her mouth. Watch the path of something as it falls. Language development. Language development may be seen in 2-month-old children. A child at this age should turn their head toward sounds. 2-month-old children also begin making sounds. Your child may coo or make gurgling sounds at this age. By the time a child is 4 months old, he or she may begin to babble. Babbling may copy sounds that are heard. Your child may also babble with expression at this age, meaning that his or her emotions may be suggested by the tone of voice. Most 4-month-old babies learn to cry in different ways. Your child may cry one way to let you know that he or she is hungry. Another kind of cry may be used to let you know he or she is tired. By the time your child is 6 months old, he or she should be able to respond to sounds by making sounds. The sounds your child makes may show joy and displeasure. Your child may even respond to his or her name. 6-month-old children are also usually beginning to say consonant sounds, such as jabbering with M and B. Children at this age also string vowels together when babbling, like ah, eh, and o. Your 6-month-old will enjoy taking turns with you when making sounds. Children usually know the meaning of no by the time they are 9 months old. At this age, children also make a lot of different sounds, like mama, mama, and ba-ba, ba-ba. Your 9-month-old will also copy the sounds and movements of other people. He or she may also use fingers to point at things. Social development. Most babies are slowly becoming more social by the time they are 2 months old. At this age, most children begin to smile at people. A 2-month-old may also try to look at his or her parents. Children who are 2 months old may also be able to calm themselves for a short period of time. This is done by bringing their hands to their mouth and sucking on them. 4-month-old children may begin to smile spontaneously, especially at people. Your baby may even begin copying some movements and facial expressions, like smiling or frowning. Children at this age also like to play with people. Your 4-month-old may cry when playtime ends. Most children are able to know familiar faces by 6 months of age. Your 6-month-old also usually begins to know if someone is a stranger. Most 6-month-old children also like to play with others, especially parents, respond to other people's emotions, often seem happy, like to look at self in a mirror. By the time your child is 9 months old, he or she may become afraid of strangers, which is normal. This may cause your child to be clingy with familiar adults. Most 9-month-old children also have certain favorite toys. When to seek medical advice. If you are concerned about your infant or newborn's development, talk to his or her healthcare provider. It is important to act early to get your child the help he or she needs. You should talk to a healthcare provider if your 2-month-old doesn't bring hands to mouth, hold head up when placed on tummy and pushing up, respond to loud sounds, smile at people, watch things as they move. You should seek medical advice by the time your baby is 4 months old if he or she doesn't bring things to mouth, coo or make sounds, Push down with legs when feet are placed on a hard surface. Smile at people. Watch things as they move. You should also seek medical advice if your 4-month-old can't hold his or her head steady. Having trouble moving one or both eyes in all directions is another reason to contact your child's healthcare provider. If your 6-month-old doesn't do the following, you should talk to a healthcare provider. Laugh or make squealing sounds. Make vowel sounds. Respond to sounds. Roll over in either direction. Show affection for caregivers. Try to get things that are in reach. Also, talk to your child's healthcare provider if your child has difficulty getting things to his or her mouth by 6 months of age. If your child seems very stiff or very floppy, you should also talk to a healthcare provider. Talk to your child's healthcare provider if your 9-month-old doesn't babble, mama, baba, dada, bear weight on legs with support, play any games involving back and forth play, transfer toys from one hand to the other. Also talk to your child's healthcare provider if your 9-month-old doesn't look where you point, recognize familiar people, respond to his or her name, sit with help. You should also talk to your child's healthcare provider if he or she loses previously learned skills. This is a sign of a developmental problem at any age.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. During their first year, babies start to develop skills they will use for the rest of their lives. Not all babies develop at the same rate. There is a wide range of what is considered normal. How your child plays, learns, speaks, and acts offers important clues about your child's development. Physical, cognitive, language, and social areas are all key to infant and newborn development. Knowing when your child should meet certain milestones can help you determine whether there could be a problem. If you are worried about possible delays in your child's development, talk to your child's healthcare provider. Otherwise, enjoy watching your baby develop. It is exciting to watch your child learn new skills. Thank you for using Explain.